So today we're going to demonstrate the OSCE cannulation. This is using the new one that we've just designed for 2015. As you can see, we have all of our standard precautions. We've got our gloves and our glasses, and I've got all of my equipment laid out ready to go. I'm using a nice little bluey, which is quite often kept in the kits of the ambulances, and it's also good to put underneath the patient's arm in case you make a bit of a mess. So we've got a Tegaderm, a cannula, our flush of normal saline, sodium chloride, we've got the Alco swab, our bung, our Luoloc, our 10ml syringe, some gauze, of course the sharps container, our tourniquet, my gloves and my glasses, which I'm going to put on. Okay, so we've got our patients in a good position, nice and comfortable, it's well lit and got good lighting, and sharps container is nice in an easy spot, easy to get to. I'm going to explain the procedure to the patient, and I'm going to ask if it would be okay if I placed a cannula in his arm. I'm going to explain how it may be a little bit painful, but the benefit of this is that it will stay in the arm, we won't need to give any more further injections, and we can keep on reusing it to provide good pain relief or any drugs or fluid administration. So once I've gained consent, I'm going to put my tourniquet on, ask him to make a fist and try and get some of the veins in the arms to come up. I can use the back of the hand, the cephalic or the antecubital region. Ideally I'd start distally and work my way up, but if I was only providing pain relief I probably would use a small cannula and a smaller vein. Okay, I'm going to swab the site, choose a nice vein, circular motion, checking that it's clean, swabbing again if I need to, waiting for that now to dry, and while that's happening I can prepare the other things that I need to use. There we go. Good to keep a rubbish container next to you, or a plastic bag or a paper bag or something. Keep your area nice and tidy. I'm just going to get my partner to also check my drugs.
Sodium chloride injection 0.9%, expiry date February 2016.
Great, thank you. Okay, I think we're ready to go. Got my cannula set up in the right position. I'm just placing it in the place that I previously cleaned, waiting for a flashback. You can see I have a small one. Let's advance it in and see how we go. I'll put some pressure on that vein so it doesn't bleed out. I don't know if we're going to be able to stop it on the mannequin, it's quite full of fluid.
Shot.
That's too quick. This is why we have some gauze. I'm just going to release and the tourniquet and work out how to get it off. Put one piece of Tegaderm over the top just to hold it securely while I do a flush. Okay, so that's flushing well, no signs of infiltration or any kind of swelling coming up. I'll finish tying it in. Keeping the view visible of where it's entering the skin. placing the other one over the top. Keep it nice and secure. We would also fill in our date and our time. It's the 27th. That's 1 p.m. Pop this on. You can pop it on anywhere that it's not in the way. Doesn't really matter. If you have a ambulance service one, you can put that on too. Okay, good to go.